Hello everyone, I'm Jana, a doula with Yema Mamas, and I'm here to tell you today about your options for childbirth. You may not know that you actually have several choices of where you can have your baby and who can care for you through childbirth. So I'm just going to tell you quickly what those are so you can figure out what you want for your birth. First of all, we know that you can have a baby in the hospital. In a hospital, you can choose between an OBGYN, which is an obstetrician or gynecologist who specializes in cesarean surgery and high-risk birth, and you also have the choice of a family doctor who may be your regular physician for your general health care, and sometimes they will also deliver babies. They will deliver normal, low-risk vaginal birth, and if they need help with a high-risk situation or for cesarean birth, they would use a backup OBGYN. And you also have the choice of a certified nurse midwife or a CNM who would be the same. They would be caring for a normal low-risk birth through a vaginal natural birth, and they would refer to a backup OBGYN doctor for the case of a high-risk situation that came up, or if they needed cesarean birth to happen. So those are your three options for care providers in hospital. Then you have birth center birth, and sometimes birth center is the name of the actual labor and delivery or maternity ward in hospitals, and they might be called a family birth center or something like that. But a birth center that I'm referring to is a freestanding birth center or out-of-hospital birth center that is not a regular hospital birthing center or labor and delivery. So this would be a place that is apart from the hospital that has midwives as your option for your care provider. They may be a certified nurse midwife or a certified professional midwife or a licensed midwife. There's various names for the midwives who work in birth centers, and they come from some different training backgrounds, but they're all able to care for you through a normal, natural vaginal birth. Again, if you were to need cesarean surgery or some special interventions, you would then be transferred to OBGYN doctor care at a hospital in that case. And finally, you have home birth or birth anywhere you want in the world. And you can choose in a home birth. Usually you will have the choice, again, of any kind of midwife. They may be considered a certified nurse midwife that does home birth, or a certified professional midwife, CPM, or a licensed midwife, or an experienced midwife, which may also be called a lay midwife, or a traditional midwife. Those midwives are experienced and may be skilled to help deliver, but they might not have licensure in their state or a certification, and so it's up to you if you want to have that care. And then they would meet you at your home, or if you choose to birth in a special place like outside or in the ocean or wherever people want to birth, then you can have one of these midwives come with you to birth there. These midwives, again, are going to be able to care for you through a natural, normal, low-risk birth, and they would transfer to hospital OBGYN care if they needed special interventions or cesarean surgery for your birth. finally, there is one other option that some people choose, and that is what some people call free birth or an unassisted birth. And that is where you choose to birth without a skilled care provider. So you wouldn't have a midwife or a doctor or OBGYN there. And you may just have support people like your husband or a friend or a photographer who you hire to be with you. Sometimes other support people will join you if you ask them. But that would be basically a birth on your own, where you just do the birth yourself and you don't have a specially trained care provider there for you. Again, this would be for a natural, normal, low-risk birth, and if you had serious complications, then you would either be calling 911 and the paramedics would help you, or you would transfer yourself to a hospital to get help. So those are your options when it comes to where to birth and who to birth with. And yeah, if you have any questions or if you know of any other options that people have, comment below, and I'm gonna put some links up here that you can learn about these different options that you have. Thank you guys, and talk to you later. Bye.